I saw Bailey's tail in the background.
Did he walk through?
You must love having you around so much.
He is in dog heaven, because dog heaven is all about your peeps are nearby and they're ready to go for a walk when they get stirred. I wanted to start by asking you, Ayanna, I know that you've been sick recently and that you were tested for COVID-19. Can you just say a little bit about what that was like and what your experience was?
Well, first and foremost, I just want to say that I'm grateful for the accessible, responsive, compassionate, and competent care that I received from MGH. I was tested both for the flu and COVID-19. Fortunately, tested negative for COVID-19, although I did have the flu. So
you're feeling better now, right?
Yeah.
Okay.
I'm feeling about as good as any of us could be, in the midst of the, such uncertain times. But yes, I do feel well.
You jumped in the middle of what's turning out to be a really important issue and a fairly significant fight right now. And so, as in the middle of this pandemic, as it unfolds, you have focused on asking the question, are people in communities of color being tested and receiving treatment at the same rate as everyone else?
Well, what prompted me to get engaged, and I'm grateful for, your partnership, but what prompted this for me is history. Mm-hmm. If we look at the H1N1, we saw communities of color disproportionately being affected by H1N1 and also having higher rates of fatalities. And of course, we know that there are great inequities that exist when it comes to healthcare access, and also based on an ecosystem of a bunch of other things, a confluence of failed policies and food deserts and so many other things. Communities of color, African American, Latinx, AAPI, Native and Indigenous people are at higher risk because they have underlying conditions disproportionately. Communities of color are not only at higher risk, but if they do contract COVID-19, they are usually experiencing the most severe consequences. The numbers that we saw coming out of Michigan yesterday, the African American community is less than 14% there, yet they represent 35% of the cases in Michigan and 40% of the fatalities. This pandemic does not discriminate, the virus does not discriminate, and we cannot be discriminatory in our response. If people are presenting with symptoms, everyone needs to have an equality of testing and also compassionate and humane treatment.
And this is where you focused in this letter to Health and Human Services at the federal level to say, look, you're already collecting data, as you say.
Yes.
Let's have the data on race so that we know for sure that we are adequately serving every community in America.
Absolutely.
And making sure that we're getting everybody tested.
When we talk about the need to collect data in access, in testing, in treatment, racial data, we already collect age and gender. We're adding race because we need to know in real time if there's disparate access to testing and to treatment. And this is not to cast any aspersions or to call our frontline patient-facing doctors racist. This is the acknowledgement that there is systemic and structural racism that is embedded that often delegitimizes the pain as it presents in people of color, and that affects whether or not the treatment they get is equitable.
Right, and that starts with having basic information. If we never collect the data on race, we can't know whether or not these disparities exist. And if you don't know if it exists, then you can't confront it and attack it head on and make it better.
We need the data to hold us accountable in real time, to ensure that access to testing and to compassionate and competent care is equitable.
Yeah, and it's equitable, and also, let's just remember the other E, it's effective. If we ignore some communities, then we run the risk that that's where the hotspots will develop and we'll be behind the curve. The part that you keep wanting to emphasize about a disease like this is you want to be ahead of it, not behind it. So part of this testing is to get the early alerts on where problems are and be able to move in with the interventions.
You're absolutely right.
And that's what your letter is all about. It's about how, it's a constructive letter, how we can gather more data, have more information. And that is good for people in communities of color, but it is good for everyone.
It's good for everyone. It's in the interest of public health. Public health.
This coronavirus crisis has laid bare inequities in our healthcare system and health outcomes that have been with us for a very long time. And now is our chance to do better. So go to the comments, ask your question, tell your story. That's how we can keep this conversation going.
Senator, it's good to see you. Good to be with you, albeit virtually, and just thanks for all you're doing out there, you know. So
thanks for all you're doing. This is really important.
Thank you, Senator.
Let's do this. Next, Ayanna and I will